Hi, everyone. Welcome to Hot Seat with Cognizant Clay. I am your host, Clayton Terrio. Today on the show, we have Dr. Mark Tarnopolsky. He is the head specialist at the Neuromuscular Clinic at McMaster Children's Hospital, which is with Hamilton Health Sciences. He has been my specialist for muscular dystrophy for several years, and he has been absolutely amazing, and am so honored to have him on the show today. I hope you enjoy it. Hit record. It's the old AI voice telling us what's going on. So,
There you go.
well, first of all, thank you for doing this. This is pretty cool.
No problems.
I figured you would be up for it. You've always been quite informative, so
Well, always happy to help.
yeah, for sure. So, well, first of all, during all this COVID quarantine, how are you doing with it?
Oh, it's really no different. I'm in here every day and, calling patients. I find, it's slower to call people. I'm seeing maybe 60% of the normal volume that we would, but I'm surprised at how much you can actually do by calling people, sorting stuff out, calling in prescriptions and all that kind of stuff.
Yeah, it's different, but we're lucky that we have the technology we do. That's for damn sure.
Yeah, it's too bad that the Zoom got hacked because I've been using this with my family and stuff, and it would be so much easier with patients to do it with Zoom. The only downside is you saw you had a few hiccups, and if I had to wait for everyone to solve the hiccups, I'd see maybe four patients a day, whereas the phone, works. And a lot of our patients, we've got older folks who don't know how to use stuff. We've got people with intellectual disability who can't use stuff. So the phone still works quite well.
Right. Well, and it is hard, but like you say, it's definitely the foolproof way. It
Mm-hmm.
still is to this day, right?
Absolutely. The old
Uh,
rotary.
yeah, exactly. So you've been, if my viewers don't know, you've been my neuromuscular specialist for a number of years. I was part of your creatine clinical study and a bunch when I was about, I think, 6. You have an
Oh, amazing, eh?
MD and a PhD in cell biology and metabolism, and you've been a neuromuscular specialist for a while. Why did you choose to go into the neuromuscular field?
Well, I've always been interested in exercise and have been an athlete my whole life. And I did my undergrad in biology and kinesiology. So I was interested in how muscles move and first wanted to be a sports medicine doctor. But I realized, after I spent a few rotations, it was kind of boring once you started learning which joints. There's only so many things can go wrong. And then as I was going through, I thought, I really enjoy muscle. And so I spent some time in the neuromuscular clinic with Dr. Fawcett, then now Dr. Goodwin, who used to run the clinic. And I thought, this is pretty exciting because I can use my interest in muscle to think about biochemistry and, how muscles work, and got more into molecular biology and stuff, which became important because back in the 80s, we knew about Duchenne dystrophy, but only towards the latter part of the 1980s did we find the gene for it. And so it's become hugely important to understand the genetics of disorders. I've kind of grown with the understanding of genetics and had to, learn on the fly all the new genetic technologies. And now we're getting diagnoses left, right, and center for people with different muscle disease, which has been a lot of fun. And I've always been interested in how exercise and nutrition are beneficial therapies.
Right, and then it's definitely an interesting. It's quite in depth as well. I've noticed. I listened to your podcast about certain. I don't even remember what it was about. It was so scientific and medical, but it's fascinating. It really is.
It is very exciting. And, certainly I think back in the late 80s when they discovered the gene for Duchenne dystrophy, I remember listening to the PhD scientists saying, oh, we're going to have a cure within 4 to 5 years. I was a little more skeptical because I've been working with people with this disorder and also realized the challenges to get therapy, to get stuff into muscle. And even now, our therapy for Duchenne is still pretty primitive. And we're seeing tiny improvements here and there, but it's not as dramatic, I think, as people first thought. And I think people were humbled when they realized after 30 years, we still don't have a quote unquote cure. Certainly our care is much better and people are doing a lot better. You're a case in point. Most people were dying in their teenage years back when I first started. And now most people are living, I've got folks into their 40s and many people have folks in the clinic that are doing well in their 40s.
Well, and that was tough for me growing up is learning about it. But even since I was a kid, it has advanced so far, and like I still sleep through the night. I breathe fine. There's no assistance. Eating is fine. Like it's I'm really pretty grateful for, how far it's come for sure.
Yeah, and it's interesting because really when you think about it, it's just attention to detail. It is, we know that the steroids, that was a huge advance. Certainly the prednisone and the deflazacort have had a big impact. And all the studies have shown it improves your ability to walk for longer before you end up in a wheelchair, improves your upper extremity function, it improves breathing, and it improves the heart. And especially the breathing and the heart, those have always been the things that have caused death in Duchenne dystrophy. And given that those are doing so much better on the steroids, it's no wonder that people are living longer. But then in addition, I think it's, nutrition. We've spent a lot of time showing how important nutrition is, showing the importance of identifying and treating vitamin D deficiency. And then as boys transition to men and are living longer, we've realized that half of our patients have super low testosterone. And replacing that in folks also can help to keep the muscle up. And I think people forgot about that because they tried giving high doses when kids were young, but testosterone is not that important. But when you lose it as you get older, replacing the deficiency state, I think also all these little attention to detail really improve people's quality of life.
Exactly, and it's just so broad. It's quite amazing, and I do thank you for your work in it because it's really quite exceptional. And you're an endowed chair at McMaster Children's Hospital, and you're part of Hamilton Health Neuromuscular Sciences. What brought you to McMaster?
Well, sort of serendipity. I came here because they had a great kinesiology program, and then after that, I kind of fell into medicine without even really thinking about it. There's these people that go in and, I want to be a doctor, I'm a med head. I just went through and had a good time and studied hard and I guess did fairly well and did my sports and volunteered and did all that kind of stuff. And then medicine just kind of made sense. And then as time went on, it just made more and more sense to focus on neuromuscular and neurometabolic disorders. So I did a PhD in cell biology and focusing mostly on metabolism because, in addition to Duchenne and SMA and muscular dystrophies, a lot of my work is in the metabolic disorders where the muscle is structurally good. It's just the energy supply doesn't work, like mitochondrial disease and stuff. So it just, one thing led to another, and I ended up spending, I think, 16 years in university. And then when I finished and started here, I had young kids, so it was kind of like more of a practical thing. But I love Hamilton. There's great places to run. Housing prices are way cheaper than Toronto. I haven't used a car in 30 some odd years. I just I run or bike to work. I use it to go up north on the weekend, but to come to work here is beautiful. I always can just, even this morning, every morning I run in, 6K or 10K, whatever it takes, depending on my route to get into work. So it's a beautiful place to live.
Yeah, for sure. And I don't know if the jersey I'm wearing is Forge FC. They've got a new soccer team, and I've always been huge into sports, and their sport culture is great. It's phenomenal.
Oh yeah.
And it's a lot of fun. I've always been a huge part of the city. What would you say is your favorite part of your job?
Well, it's a tough one, and it, things fluctuate a little bit throughout your career where some things are more interesting. At the end of the day, the most important thing obviously is patience, and certainly seeing that people acknowledge that, we spend a lot of time day and night and, I don't care about the time clock. You just do what you can to help people out. And when that's acknowledged, it's pretty cool. So direct interaction with patients really is the end goal. But of course, at times the research is really exciting because you get a cool finding and it's like, oh my God, this is really amazing. And this could help people and I can apply this to folks. So the research is a lot of fun. I'm winding down a little bit on the basic science stuff now, just because I'm finding that there's just so much that we're doing with gene discovery. So it's more directly patient-related stuff that we're working on now, and less stuff with the animal models and the cell culture and everything. We still do a little bit of that, but when it comes down to it, it's that direct interaction with people that is so exciting.
For sure. What kinds of reactions do you get from the patients and the families of the patients that you help?
Well, most people, I think, are aware that, you're doing your best. Unfortunately, we can't cure things. And it's a tough disease because, we see all sorts of horrible neurodegenerative disorders. And I have to go up to the neonatal ICU in a few minutes to see a kid with a disease that's going to take their life. And, those are challenging things to deal with. But I think people, for the most part, probably 95% of all the folks that we see appreciate that at least you're doing your best, and you're working hard, and you care about the patients, and you do as much as you can for these individuals. And it's nice to see. It's also interesting too to see the evolution, because certainly when you first talk to people and you give them bad news if they've got a bad disorder, it's nice to not be nihilistic about it. And I've always felt that there's things we can do for people at many levels, from psychosocial support to just being there to listen to folks, looking at all the little details, like making sure contractures don't happen, thinking about nutrition, thinking about skin health, thinking about all the little things that make someone's life a little bit more comfortable, and dealing with all of those things, I think, gives people hope, and it's exciting to see that.
For sure. And then, like I said, when I was growing up, it was hard, but I think it's hard for a lot of people, but it's how you manage it and how you deal with it. It's everybody has a problem, but when it's like an actual condition, I find I'm grateful for how far I've come and what I've taught people as well. You know what I mean? It's a very good learning curve for a lot of people.
Yeah, and it's people like you and doing things like this that I think are so important, because when we see families and we make a diagnosis when someone's 3, 4, 5 of Duchenne or any neuromuscular disorder, when you can see folks who are doing the sort of things that you're doing, that have a positive attitude, that are productive and doing cool things in their 20s, 30s, and 40s, it gives people hope. I think there is a very nihilistic approach to neuromuscular disease, and people thought, well, that's it. You're a teenager and you're not going anywhere. I mean, I just got off the phone from a youngster who's almost 20 now, going to Carleton with Duchenne, and the supports are in place, does sledge hockey and all sorts of cool stuff. And, like you, very upbeat and optimistic, and gives people a lot of hope.
For sure. That's really good to hear. Just to add to that, what advice would you give to families and people who are diagnosed with these disorders?
Well, I think a number of things. Number one, there's always hope, but we have to have realistic hope. But, and again, I remember years ago when I had some people, because not everybody is appreciative or nice, and, they'd sort of yell at you and say, well, if you can't cure it, why am I wasting my time coming to see you? But what we've talked about already is age 18, 19 was when most people were dying, 20, 30 years ago. Now folks are living into their 40s. We haven't really done a lot, but it's all that attention to detail. But we're not curing anything, but we've doubled people's lifespan, and we've improved the quality of life. And that's pretty cool. So, I think, that's an important point, is attention to all the tiny little details add up, and over a long period of time make a huge impact on people's life.
For sure. And it is hard, but like you say, it's come so far. We have a lot to be grateful for. And you founded Extrakind in 2013, which develops therapies and improvements in the lives of patients. Talk me through a little bit what that's all about.
Yeah, so we started off realizing throughout many decades that exercise is probably the most effective therapy that we've seen. We've got one family that when I diagnosed the youngster, I think he was 3 or 4 with Duchenne, and his grandfather was into yoga and stuff. So he spent 2 hours a day exercising with this fellow. He's in university now at 20, never went on corticosteroids, and he's still walking with Duchenne dystrophy. So, I mean, that's pretty striking. And so we started doing stuff in animals where we exercised FSH dystrophy mice, Duchenne dystrophy mice. In every study we've done, we found that exercise is beneficial. And so what we wanted to do is to identify, well, if it's so darn good, what is it about exercise that's good? So one of the things that exercise does, it releases chemicals into the blood, which then impact various tissues. And I came up with the term in a lab meeting about 10 years ago. We called those things Extrakind. And so we first set out to try and identify what these were. thinking maybe we can come up with 20 or 30 of them, put them in a little syringe and inject them into people. And even if they can't exercise, we'll get the benefits. So we actually identified one called interleukin-15, and it improved skin health, increased the mitochondria, and improved muscle a little bit. The problem with those compounds is that when you look at the regulatory issues and hurdles that you have to go through, it's tens of millions of dollars, many, many years of development. So yeah, we got the patent on that, but then we very quickly realized this is going to just cost a fortune, and it was going to be a challenge for the company to move forward. So then we changed our direction a little bit, and we went back to our roots in different nutritional compounds. As you know, we published that paper that you were part of with the Duchenne dystrophy and creatine study published in Neurology, I think it was 2007. And so what we did is we started to look at combinations of different supplements to try and improve people's function. So the first one we came up with, and we've got 3 clinical trials showing benefits, was creatine with casein and whey protein, vitamin D, calcium, and high-dose fish oil. And what we found, we just were going to submit the paper pretty soon, that the older adults who went on that versus placebo got an increase in their muscle mass. Their muscle mass to fat ratio was favorably enhanced. And what's cool is we're working with Chris Perry now at York, and we've taken that, tweaked it a little bit, and added a few things to it to make it a better muscular dystrophy / Duchenne supplement. So Chris Perry, who's one of my good friends and colleagues at York, is going to take our new supplement that we've created with Extrakind, which is our muscle enhancer, and now we're going to start applying it to different disease models. So if it works for the Duchenne dystrophy mouse, it'd be fantastic to start trialing this in humans. The downside, of course, I realized is that even when we did the creatine stuff, we came up with another combination, and we applied to Muscular Dystrophy Association, but we didn't get funded, I think, because people want a single drug. They don't want to think about nutrition as being effective. And I think there's a pretty big lobby, too, with the drug companies. They don't want to know anything about exercise or nutrition because you're not going to make billions of dollars with the drugs. So as a consequence, we're trying to do this through Extrakind, and we started the company to say, well, screw you. We're going to do what we think is going to work the best. And some of our stuff so far appears to be very safe and quite effective at improving muscle mass.
Awesome. Good to hear. So I have a little segment here called Rapid Fire that I do with my guests, just to ask a few, random questions. I'm curious. I couldn't find much about you during research. Where did you grow up?
Newmarket.
Oh, interesting. So that being said, who would be your favorite person from Ontario?
Holy crap. Probably Bob Ray, I would guess. Yeah, he was pretty instrumental when we were getting together. And because of Bob Ray and the Bob Ray days, my wife and I actually met. And without him, I never would have gone for a walk with her and got married to the best woman in the world. So that's why Bob Ray's my favorite.
Brownie points. That's a good one. That's a good one.
Yeah.
What is your favorite thing to eat?
I really like very good quality pizza. The one I'm really hooked on right now is Bluebird Cafe Pizza from Orangeville. So if anyone goes by there, they have the best pizza in the world. And my sister lives in Italy. I'm telling you, Bluebird Cafe Pizza in Orangeville, best.
Oh, wow. There you go. I'll check it out for sure. And judging by your resume, it seems like you do not get very much free time. But when you do have free time, what do you like to do?
Well, I think everyone knows that I'm absolutely addicted. And my good channel for my ADHD is exercise. So I run, I bike, I ski, and I love playing around with my chainsaw and my tractor.
Well, that's good. That's good. Other than skiing and running, do you have any other sports that you follow?
Yeah, it drives my wife nuts, but I do, actually I've been watching the Doha World Championships for track, all the running and field events. That was fantastic. So it's on YouTube every night now, the 2019 World Championships. I also watch downhill skiing. That's really cool to watch. And sometimes the Red Bull Rampage.
Oh, awesome. Yeah, my mom and I really like our skiing, anything alpine, slalom.
Oh, yeah, for sure.
It's fun to watch. This is just a curious question here. How often do you get asked or compared to Bill Gates?
Never.
Really?
Never.
Really never. Well, we think you look kind of like him, so.
Oh, really? That's kind of funny.
And this is my little smart ass question of the rapid fire. If you weren't such an egghead smarty pants, what would be your backup profession?
Oh, that's very easy. And actually, it was interesting because when I was 16, 17, I used to work out in Alberta as a carpenter, and I was offered a job as the head carpenter for a company out there called Delta Cats. And it was a tough decision to go back and go to university or to stay out there as a carpenter. And even now, like my wife and I just built a sofa bed yesterday. I built a 1,000 square foot deck. We completely renovated, rebuilt a cottage up north. Our first house, my wife and I pretty much tore the thing apart and rebuilt it. So definitely be a carpenter and a contractor.
Oh wow, awesome. Yeah, my grandfather was actually a carpenter, so that's pretty
Yeah.
deep profession to my heart for sure. It's a fun one. It's a really
Oh,
fun
I
one.
love it.
So I was back into the questions here a bit. Apart from your neuromuscular career, what other advocacy or awareness foundations or charities do you support?
Yeah, I mean, most of them, I got to keep it close, and I got to spend my time in the two areas I'm most interested in. Of course, Muscular Dystrophy Association, and the other big one that I'm really involved in is Mito Canada. So mitochondrial disorders. And actually, I'm doing a similar interview tomorrow with the Mito Canada group, and we did a big COVID-19 mitochondrial thing last week. So, and part of my company's profits, if we do make a profit, which I hope we do, are going back to support Mito Canada. And yeah.
Oh wow, awesome. Good to hear. So in terms of that, I was just curious, is there currently right now, is there any, apart from the Extrakind stuff you talked about, is there any other clinical trials going on right now that are of notable importance?
For Duchenne?
Yeah, for Duchenne or any neuromuscular really, but Duchenne mainly.
Yeah, I think certainly, people are interested in the whole exon skipping, given that 2/3 of cases of Duchenne are deletions, usually in the middle of the gene. And so there's various genetic strategies where you can sort of convert, for lack of a better term, Duchenne into Becker's by essentially joining these together so that the gene doesn't break down. And, there have been some benefits that have been seen. I think they're continuing to work on improving the quality of those. And I know the one youngster I was talking to today is involved in one of the Sarepta studies with that. So we'll see where that exon skipping goes. It can't help but get better. If we gave up when we first started cancer therapy 40 years ago, we would be nowhere. And yet now for acute lymphoblastic leukemia, there's a 90-95% cure rate depending on the age of the kid. So every little incremental step, I think we're going to learn more and more. We've already doubled the lifespan of Duchenne dystrophy with nothing specific other than all the little attention to detail. So I expect 20, 30 years from now, I think we're just going to keep adding until we get people, living into their 60s and 70s, which would be fantastic.
For sure. And after, I know you talked about you're kind of winding down in your career a bit. Is there anybody who, like, you're teaching or mentoring that you feel will be the next, like, Dr. Tarnopolsky, if you will? Like, is there any people coming up that you work with?
Yeah, I think right now, no one specifically. We've tried over the years. Part of the challenge, I think, is to run a basic science lab, to do clinical trials, to see patients, and then on top of it, as CEO of a company, there's only so many hours in the day, and a lot of people, I don't think, when I started, it was 90 hours a week for the first, 12 to 15 years. Not a lot of people are willing to put that time in, so that's going to be a bit of a challenge. What we're hoping to do is over the next 5 years, get pediatric neurologists to do neuromuscular fellowship, take over the Duchenne and the SMA. I'd like to be there to transition them for the next 3 to 5 years. I think the adult aspect is probably going to have to fall by the wayside. But there are a lot of very good adult neuromuscular physicians in Southern Ontario now, which we didn't have a few years ago. So I don't think that that's a big issue. Certainly, I'd love to get one of the younger folks in here over the next 3 to 5 years, which I'm pretty sure we can do. The metabolic aspect of things is usually a completely different group of people. Usually those are metabolic genetics folks. So that may be a bit of a challenge. I might have to farm that out elsewhere, but we'll see.
Good to hear. Good to hear. Well, like you say, it's improved quite a bit, and I remember when I was younger, there was not very many neuromuscular specialists, and now you look it up, and it's all over the internet too. It's
Mm.
quite good to see that. So during this whole COVID thing, it's hard for a lot of people to, raise awareness for charities or whatever. How would you recommend people keep the awareness for neuromuscular disorders going through this shutdown?
Well, I think certainly the thing that I found interesting is that I'm spending much more time doing video conferencing and stuff. And to me, it almost seems like there's more awareness that's coming now. And we're going to learn better how to use these virtual spaces. I mean, you look at the quality of this Zoom meeting, for example.
Mm-hmm.
I didn't know what Zoom was. So, I mean, yeah, we saw it once in a while 6 months ago, but now all my family's using it. My wife's mom, who's like in her 80s, who's the most computer illiterate person in the world, we actually got her up and running on Zoom. So I think with increased awareness and increased quality of these sort of programs, I think it's going to help people to spread the word and virtual space learn more and more. And actually, I think it's going to help because I think we're going to just reach more people over time.
Exactly, and that's just it. It's quite amazing. Have you done any appointments with Zoom, or is it mostly just the phone, like you said before?
Yeah, the challenge with the Zoom is, as you know, about 3 weeks ago, there was that whole thing where their stock dropped like a stone because there were some examples where people were doing PhD defenses on Zoom, and they had some hacker come in and put porn on. So with things like that, we were told that we're not supposed to use Zoom. I mean, I can do it in this context because I'm not talking to you as a patient. So as a patient, we have to do it by phone. And there's an OTN network thing that we can do. But I've heard that for most people, it's a real challenge to get it up and running, especially people who aren't as computer savvy as you are. But I'm hoping that technology is going to make these things easier. And when I look at how easy Zoom is becoming, I have hope for the future that this is just going to be a much easier way of moving forward. And I just hope they can get the encryption so that we can do this with everyone in case we do have to do remote access consults.
Yeah, it definitely makes it easier. As it progresses, travel's getting harder for me, so it's definitely very appreciative of all the technology. Like, my friends are all, obviously I'm high risk, so the only people coming over are my mom and dad to help me shower and whatnot, but I play Xbox with my friends every day just to talk to them. We don't even have to play games. Sometimes we just watch Netflix together or whatever it is, and it's great. It's definitely helped for sure.
That's cool. Yeah, no, I agree. That's a great point.
Yeah, and video games, that's my exercise. I always joke. My hands are actually pretty good because of it, so
that's good, the dexterity, and that's so important.
Yeah, for sure. I can still text completely on my own, so I'm happy. Well, that's about all I have, Dr. Tarnopolsky. Thank you so much for everything you've done throughout my life and for giving your time. Your bedside manner and your dark sense of humor is quite exceptional. So it's great to see, and I'll send this out to you once I post it.
Great. Well, thanks so much, Clayton. It's great talking to you, and thank you so much. I think everyone really appreciates what you're doing.
Awesome. Thank you. You have yourself a good one.
I will. You too, eh? Bye-bye.
Right. See you later.
Thanks.